Good afternoon. Dr. Dee Roach, Jennifer Hale, coming to you again from Mitchell County Hospital to discuss with you the current status of the COVID-19 virus in our community. As we discussed last time, we have seen an increase in the occurrence of COVID-19 positive cases in our community. We also discussed that this was not a particularly great surprise, a consequence of certainly the increased number of testing that we've been doing, but also representative of the community, state, and United States in general, where we are seeing a significant rise in number of cases per day. A consequence of this certainly is the fact that now we're starting to see increasing numbers of hospital admissions to our hospital with positive COVID-19 symptoms, and because of this, we're having to take a more aggressive posture regarding visitation policies. To review those changes in our policies, Jennifer is going to go over those with you now.
As Dr. Roach said, we had a change in our visitation policy, and this will be in effect starting November 12th, 2020, until further notice. In an effort to protect our patients and staff from exposure to possible illness and comply with CDC's recommendations, MCH has chosen to limit visitation to 1 visitor per patient for their length of stay. Exceptions will be made for extenuating circumstances for minors or adults with disabilities and per discretion of the provider. In addition to this change, the visitor will need to provide a negative COVID test. No visitation will be allowed until a negative COVID lab test is reported, and furthermore, weekly negative COVID lab tests will be required by the visitor to continue visiting. COVID testing from another facility will be accepted if a copy of the negative test result is presented. In the event that you do not have a current COVID test, testing can be provided for you through Mitchell County Hospital.
So changes in visitation, certainly is not something we were anxious to implement. However, these things are done explicitly for the purposes of protecting our staff, our employees, our patients, and the community in general, and we appreciate your understanding and cooperation with them. We can overcome this virus. We've proven that. We encourage you every day to wear your mask, maintain social distancing, and make good decisions, particularly if you think or know that you're going to be around someone who has had COVID symptoms. Take care of yourself, be safe, and we'll be in touch with you later.
Thank you.